Joining us now, straight from the House floor, Democratic Congressman Morgan McGarvey of Kentucky. He's a member of the House Budget Committee. You've already had a long night, and I know that we're sort of on the clock for whenever Hakeem Jeffries stops speaking and this actual vote goes on. But take us inside the mood on the floor right now among Democrats, and if there's any conversation with Republicans between the parties.
Welcome back to Conservative Current, where we cut through liberal spin, defend American values, and stand strong for truth, family, and freedom. Tonight, we're responding to a segment that's blowing up across left-wing media. They're calling it a healthcare crisis. They say Trump's tax policies are going to kick 12 million Americans off health insurance, close 35 hospitals in Kentucky, and devastate rural America. Sounds awful, right?
Between the parties.
Democrats are still fighting, and obviously we're frustrated. This matters to us. This is more than policy. Look at my state of Kentucky. These aren't just numbers, right? 35 rural hospitals are going to close in my state if these cuts go through. That means people who live in rural America right now, I got a text message from a woman named Donna. She says, we drive 30 minutes right now to get to the hospital. If the closest hospital closes, when it closes, and when someone gets sick, when someone has a heart attack, when someone has a stroke, and minutes matter, they're driving an additional 30, 40, 50 minutes to get to a hospital. This is the difference between life and death. This is why Democrats are fighting. This is why Jeffries is on the floor right now fighting, because this matters. It really is going to have an impact on people's lives.
And this vote, although we expect it to pass, is going to be close because the margins within the House are as close as they are. But we've actually spent a lot of time focusing on Kentucky Republicans because Rand Paul, Thomas Massie on the House side have been some of the more outspoken members against their party, against the president on this bill. Why Kentucky? Bring us inside the dynamics of your state and why this bill could be so detrimental that these two Republicans would buck their party in an era where we don't really see that very much.
Well, this bill is a complete slap in the face to Kentuckians. Yes, 35 rural hospitals are going to close, more than any other state. 133,000 rural Kentuckians will be kicked off their health insurance, more than any other state. Kentucky will lose $10 billion in rural Medicaid reimbursements, more than any other state. I served in the Kentucky State Senate for 10 years before coming to Congress. I can tell you, we get more money every year as a state in federal Medicaid dollars than the entirety of the Kentucky state budget. Now, I don't know if that is Senator Paul's or Congressman Massey's objection to the bill, but they're doing all of this, and they are hurting Kentuckians. I mean, every day, hardworking Kentuckians. They're hurting Kentuckians, and they're doing it while giving the richest Americans a huge tax break and driving up the national debt by trillions and trillions of dollars. And so, with Senator Paul, with Congressman Massey, they've been, pretty steadfast since they've been here, given consistency points that they don't want the nation to go further into debt. This bill drives the nation further into debt, just like it did the first time Donald Trump did this. And people don't bring that up. We have a blueprint to look at. Donald Trump has done this before. It drove the nation further into debt. He's doing it again. It will drive the nation even more into debt.
Yeah, you're talking about those 2017 tax cuts, which even when they were passed at the time were projected to add to the national deficit. Now these are the same tax cuts that are being extended. And so when Republicans are talking about it's a tax cut, it's not a new tax cut. It's an extension, and it's a stopping of those tax cuts from going away, from basically doing an accidental tax hike because they couldn't extend those cuts. We expect them to be able to do that here. We see, for example, that Thomas Massie is then earning the ire of the president, saying he's going to push primary challengers against him. You have the district next to his. I imagine your TV is going to be full of ads. But have you talked to Republicans about these concerns? I mean, you even hear it from some of them voicing the fact that they don't think that this is great policy, but the political dynamics are such that they're not pushing back. I mean, have you had bipartisan conversations about this bill?
Yeah, that's one of the things I really hate about this, is behind closed doors, Republicans know this is bad. They know it's going to drive the debt up. They know who these taxes benefit. It's the richest Americans. They know that, especially in rural states, it's really going to hurt people. But then they don't have the courage to do and say in public what they're saying in private. And all we need, why we're continuing to fight, all we need are 4 Republicans to have the backbone to stand up and say this bill is not ready for prime time, which Lisa Murkowski already did say out loud.
Yeah.
Even after she voted for it, it's not ready for prime time. Let's go back to the table. Let's get this thing right.
As we wrap up here and go to a quick break and get you back to the House floor, how do Democrats continue to extend this in the minds of Americans? A year before the midterms is a really long time. What's the plan, and how has the caucus talked about this?
Yeah, I mean, how we're talking about this is, look, What they did in this bill, they are helping the richest Americans get even richer. If there's anything even for anybody else, it's not permanent, right?
But beyond the messaging, right? I mean, like, what is the forum to keep this front of mind?
I think we will continue using every form imaginable, whether it's social media, whether it's earned media, whether it's getting on TV, whether it's going into communities. I had a town hall Monday night this week for a pop-up town hall on Medicaid. And I mean, tons of people showed up just because they want to share their stories. This is not about numbers on a sheet. This is not about some policy that's foreign in Washington. I can tell you, when you come to Kentucky, when you see the rural hospitals that will close, the people who will lose their health insurance, the people for whom this is life or death, this matters, and we're going to continue to tell those stories.
Congressman.
But here's the truth. It's not what they're telling you. And what they're not telling you matters even more. 1. Let's get this straight. No one's kicking anyone off anything. This narrative that Republicans are somehow sitting in smoke-filled rooms planning how to rip healthcare away from grandma is not just dishonest. It's insulting. Let's be real. What Democrats cry about is that federal subsidies, paid by you, the taxpayer, may not increase forever. That's it. No one is saying Americans can't have insurance. We're saying the federal government shouldn't be your doctor, your insurer, and your wallet. 2. Rural hospitals are struggling, but Medicaid isn't saving them. Yes, some rural hospitals are under strain. But here's the part the media won't say out loud. Many of those hospitals are struggling despite decades of Medicaid expansion. Pouring more federal money into a broken system doesn't make it better. It just delays the reckoning. What rural America really needs is economic revitalization, local decision-making, and less bureaucracy, not more red tape from D.C. 3. The real fight? It's about Trump's tax cuts. Ah, yes, the dreaded 2017 Trump tax cuts. According to Democrats, they're a sin against humanity. But let's not forget, those tax cuts put money back in the hands of millions of Americans and small businesses. They didn't just help the wealthy. They boosted the economy, increased wages, and lowered unemployment to record lows, especially for minority communities. They call it a giveaway to the rich. I call it economic freedom. For debt hypocrisy, suddenly Democrats care about the deficit? Now this is rich. Congressman Morgan McGarvey says this bill will add trillions to the debt. This from the same party that passed the $1.9 trillion American Rescue Plan, threw billions at green energy fantasies, and racked up more debt than any generation in history. You want to talk about debt? Let's start with the student loan bailouts, the EV subsidies, and billions for Ukraine, before you point fingers at working-class tax relief. 5. Republicans are cowards? No, they're realists. McGarvey says Republicans privately agree with him but are too scared to say it out loud. Really? Maybe, just maybe, they don't agree with you, Congressman. Maybe they understand that government-run healthcare is unsustainable and endless spending is dangerous. And as for Rand Paul and Thomas Massie, say what you want about them, but at least they stick to their principles. Unlike many in D.C., they're not just playing politics. They're trying to stop this country from drowning in debt. 6. Democrats' only strategy: scare the public into submission. This isn't about health care. It's about control. Democrats want to convince you that unless they run the system, people will die. That's not policy. That's fear-mongering. McGarvey talks about people having to drive 30 minutes to a hospital. You know what would fix that? Better roads, stronger local economies, and local investment. Not Washington pouring billions into Medicaid like it's a magic fix-all. 7. The personal stories are real, but so is the bigger picture. Yes, Donna in Kentucky matters. So does her story. But you know who else matters? The millions of hardworking Americans who are paying more taxes, getting less care, and watching their premiums go through the roof. Government health care doesn't treat them like human beings. It treats them like numbers, and it makes them dependent. 8. We stand for freedom, not dependency. Here's what we believe. You should choose your doctor. You should be rewarded for working hard, not penalized. Your taxes should go to roads, troops, veterans, and border security, not bloated bureaucracies. Government should serve, not control. 9. 2024 is coming, and Americans are waking up. This entire debate is part of the bigger game. Democrats are trying to spin every policy move into a life-or-death crisis to scare voters before the next election. But Americans aren't buying it. We're tired of being told we're cruel for wanting fiscal responsibility. Tired of being called extremists for wanting the freedom to choose how we live, how we work, and how we get care. So to Congressman McGarvey and every Democrat using fear to push dependency, we see through it. This isn't about killing health care. It's about saving our future. This isn't about punishing rural Americans. It's about setting them free from a broken system. And this isn't about compassion. It's about control. We don't want that. We want liberty. We want personal responsibility. And yes, we want our country back. That's the conservative current. Share this, subscribe, and help spread the truth. Until next time, stay informed, stay bold, and stay free. God bless you, and God bless the United States of America.